All right, again, if everyone can make their way toward the seats, take a seat. We will begin our presentation. As you are doing so, I'll introduce myself. My name is Matt Serwe. I'm relatively new to the Twin Cities. I work for 5 Eyewitness News, KSTP. I'm a meteorologist, and I absolutely am thrilled. I was very lucky to connect to Face right away when I got to the cities, and I'm very honored to be able to give back in this way to help support them. Welcome to the 50th anniversary celebration for Face to Face. Thank you to everyone here in Union Depot and those streaming this online. We are here this evening to continue our support of this wonderful organization. Please be generous tonight as you hear from those directly involved with the programs and those who are impacted by those services. Those of you in Union Depot were able to speak to Face team members this evening. Each one shows how the organization takes a holistic approach to empower young people. The funds you give tonight will go directly to supporting all these different parts of Face to Face. Part of this community includes the Face to Face board. I'd like to bring up a couple members to recognize the board. Dr. Thomas Kotke is the board chair and cardiologist and epidemiologist at the medical director of well-being at Health Partners. And Deb Loon Stumbras is the board vice chair and executive director of the Minnesota Valley Trust.
Thanks, Matt. Good evening. As Matt mentioned, I chair the board of Face to Face, and up here with me is Deb Loon Stumbras, vice chair of the board. The other board members are standing by the stage. I would like to recognize the former board members who are here. Would you please wave your hands right now? Thank you. We are grateful for board members past and present and for their commitment to youth. Tonight we are celebrating and honoring youth for all they have accomplished. We know that just the right support at just the right time can create a difference that lasts a lifetime. Finally, we are especially grateful for 50 years of support from volunteers like you, donors, businesses, foundations, public funders, and our community. Thank you all for attending the 50th anniversary celebration and for supporting youth.
Good evening. I too am honored to welcome you and to thank you for joining us tonight. For 50 years, Face to Face has cared for youth and responded to community needs. It was created by volunteers in 1971 to provide phone crisis counseling for teens. The next year, in April 1972, they incorporated as Face to Face Crisis Center, and they created a drop-in medical clinic staffed by St. John's Hospital physicians and residents. In 1974, Nan Skelton was hired as executive director. Nan stayed in that role for 9 years, a period of tremendous growth in response to community need. During her time, Face to Face started providing health education and mental health counseling in the schools, created the Adolescent Abuse Project, started providing pregnancy care, a youth employment program, and a teen fathers program. In 1987, Ann Ricketts was hired as executive director. During her 15-year tenure, Face to Face continued expanding to address needs. It launched a school-based clinic at Harding High School, a summer youth program, outreach to pregnant youth, outreach to homeless youth, an HIV/AIDS prevention program, Face to Face Academy, and a youth employment program with Dayton Hudson. And Face to Face held a capital campaign and in 1993 moved into its building on Arcade Street. In 1994, Face to Face opened Safe Zone, a drop-in center providing supportive services to youth experiencing homelessness or unstably housed. And if that wasn't enough, they expanded services at the Arcade Clinic to become a primary care provider. Ann and Nan led Face to Face through most of its first 25 years. In the last 25 years, this organization has continued adapting to the needs of the youth and the community. Face to Face has expanded services and hours at Safe Zone, making it a place where unstable youth can find a holistic range of supports. Face to Face also has expanded medical and mental health services, created housing for youth and young families who are homeless, ran a hotel shelter program during the pandemic, and much more. It's never been easy, but it has been vitally important to tens of thousands of young people in this community. This evening, you will hear much more. Right now, I ask you to help me thank two remarkable women. Nan Skelton and Ann Ricketts have provided 25 combined years of leadership and have remained committed as donors and volunteers for the last 25 years. Recently, Ann and Nan have spent months tirelessly going through historical records of Face to Face, working with the Minnesota Historical Society to archive and preserve the history of this organization. They also raised funds for and are leading an oral history project to record some of the personal stories of Face to Face. Nan and Ann, we are so grateful to you for your commitment to Face and its youth. In honor of your significant contributions to ensure the history is recorded and preserved, please accept these flowers. The center flower is actually a gold rose in honor of the 50th golden anniversary of Face to Face.
I mentioned off the top how I've only been here a short time, but I felt an immense personal connection to the mission behind Face to Face. I know what it's like to receive support from my community when I needed it in my youth, my adolescence, and young adulthood. It includes a traumatic, abusive childhood, at times living with my siblings in safe spaces provided by strangers. It includes teenage years as a closeted gay man at a time where it was still difficult to admit that publicly, and fingers crossed we're not coming back around to it. And that includes lingering depression and anxiety that to this day is treated with the help of mental health professionals. I understand how important it is for everyone in every community to have access to quality, affordable health care, and specifically mental health care. I fully acknowledge as a cis white man, I have certain advantages unlocked in society where others repeatedly find closed doors. The video you're about to watch has staff, youth, former youth, and a parent sharing their story that demonstrates their strengths that have been unlocked and empowered by Face to Face.
Face to Face is a very, very good nonprofit organization that I recommend to a lot of different youth and people that are experiencing homelessness.
It's been a safe place every time.
They are not judgmental. They want to meet you exactly where you are.
Everyone should be helped no matter their background or socioeconomic status.
Forming relationships with young people. That's how we do our work. We build relationships, one youth at a time. Is that Hannah? Oh my goodness. Hannah! My name is Hannah Getacho Cruiser, and I'm the executive director here at Face to Face. I love young people. I didn't know that early into my career, but I am hooked to working with the younger generation for the rest of my life. We serve young people between the ages of 11 and 24.
Youth who have layers and layers of barriers and have been through really, really hard things and traumatic things.
It helps youth that are really, truly trying to get on their feet and find resources within the community and help them expand and move forward in the right direction. It empowers a lot of youth, to be honest with you.
It started as a community response to the crisis with young people. Since then, it has been, growing and adding things, and the community has been working very hard to try to be there for the young people and their needs.
They're clearly an anchor tenant on the east side where people know they can get the help they need. My name's John Bennett. I'm a senior vice president at 21st Century Bank. And over the years, I've had the privilege of being the banker for Face to Face. This is designed to help youth become empowered to understand what resources they have and know that they can share openly in a loving and welcoming environment.
Gosh, I don't know where I would have been had it not been for Face to Face. I was initially turning 27, so aging out of my parents' health insurance.
Well, this was a bit of a family project, so Abby and I steered this together.
We did head to Face to Face. They helped us navigate the healthcare system of the state of Minnesota.
The paperwork was a little ominous, but we met on several occasions with a staff counselor, and then they kept track of the application as it went through the government process.
It made me not have to worry about health insurance. It alleviated a stress. It took off a weighted blanket, if you will. Face to Face really saved me.
The way we work that makes it really unique is that we spend time with young people. We get to know them, and we believe in their strength and their ability to overcome. And that is something that works. Simple and profound at the same time.
I think just being in a place where people know that they can go. It's been here for a very long time, as we're acknowledging now. And there are clients whose parents have gone there, whose kids are going here now.
I can't wait till they open on Monday so I can be safe again, or, I feel safe again. I can take a nap and feel safe. I can go see my therapist at Face to Face and feel safe. You can't get no better than that.
My name is Dorothy Chella, and I am one of the mental health supervisors. The clients that I serve at Face to Face are young kids of color, they're teenagers, and then just being able to provide a person that looks like them, that's an adult, that feels like a safe space, or somebody that they can talk to, that they can relate to, and that in lots of ways can relate to them.
Having a safe place for me, and then when I became a mother, my children. And then my mom has also went there, and it was a safe place for her, and we did open mic, and she felt so safe she was able to be creative and start do-do-do-bop. I started going to Safe Zone because a homegirl of mine, that's what I called her, we didn't want to get into anything negative, and I wasn't at the time. And she was like, hey, come with me. And so we're spontaneous, and I trust her, so I went with her, and that's how it kicked off. It's a comfort zone for me. That's what I've used it for.
Some of the services Safe Zone provides are basic needs like hot meals, hygiene supplies, transportation support. We also offer one-on-one case management services where young people are able to identify goals that they want to achieve and receive the support needed to achieve them. We have walk-in mental health services, education for sexual health, as well as healthy relationships and how to interact with each other. And probably most importantly, Safe Zone is a safe place for people to just be.
Young people that we serve every day have been able to pursue their dreams, be stably housed, have had their health care provided.
We serve really amazing, resilient youth, and our patients are teaching us something every single day. I am Pam DeWitt Mesa, and I'm the medical clinic supervisor at Face to Face. And what's cool is they find an open door at Face to Face. We can serve them and really wrap around with different services. Being able to offer medical services along with mental health, case management, health education is really powerful.
There's somebody I'm really proud of who I literally met him on a Zoom court call. He was literally homeless, and we got him housed for a while in the hotel. He got a job, worked as his new addiction, but he's rocking and rolling. David Starks. My role right now is a youth diversion case manager. When I first got hired at Face to Face, I was an employment coach coming fresh home from 5-year incarceration with the federal government. And Face to Face we really do provide a complete, holistic approach to a situation.
Face to Face got me started on my journey on the right track. My name is Carlton Eugene Munger Smith. That's the whole name. Go by Tone, Money Man Tone, nicknames as well. Yup. They helped me get employment. They helped me get into my housing, helped me get into schooling as well. And then I actually started working for Face to Face. They helped me get a lot of tools just to like move forward and overcome things and overcome challenges, barriers that I was hindering me from moving forward into my life. Yeah, I felt very, very empowered.
A lot of times, the traumas that people go through really hinder their own self-worth and self-image and don't allow them to see what's really inside of them. And I think that we're able to most often ask the right kinds of questions and just have the right kind of conversations to allow them to get back in touch with those parts of themselves.
The best thing you can do is be honest. That makes me feel empowered. When I can be honest to people and when they're honest to me.
I love that about young people. They're honest. There's no guessing with young people.
One thing to note, I guess, about youth is that a lot of our youth come in themselves. I think most of their lives are not in their control, and yet they still try. I think that inspires me, that when things feel really hard and uncomfortable, to just be like, my young client can do this, I can do this too.
It's great and inspiring to watch people make life changes based on these strong relationships that they have with staff. I think that's really amazing.
And we have a real good group of people I work with, like an amazing group of people I work with right now at Safe Zone.
I want to be present. I want to show up every day and do my best for the youth that we serve because they deserve it.
I built so many relationships, connections through clients, peers, staff. Oh, Paul Yang, I love you to death, man. Shout out to you. If it wasn't for you, I wouldn't be where I'm at, truly. And I'm blessed and thankful to have you in my life.
The other day, a Safe Zone, I believe she's a manager now, and I gave her a hug the other day, and it felt so safe. And I don't even know this lady's name. That's how my relationships go with everybody there. And it feels very sacred. It really does. My life has been impacted greatly by being a client at Face to Face. Really learning about myself. Oh, I am a leader. I am creative. I've been those things since I was 3. This is me. This is who I am. And I've always been this person, but now I can identify it and I can be more bold about it.
We are honored, and what a privilege to be in a space where healing and transformation happens. I don't know very many professions who can say that, and that's an honor and privilege we don't take lightly. Right now, as I average about 60 to 80 young people coming to us every single day for support, for resources. We are a safety net for our community.
While we really appreciate and need the community's support to be able to keep offering the kinds of services that our youth need and deserve.
Thanks to the support from the community, we have been able to expand a lot of the resources we've always offered at Safe Zone and Face to Face. Some of the things include installing a refrigeration device on our food shelf so we can offer perishable food items. We've added different programming and educational opportunities at Safe Zone, as well as additional case manager and therapeutic positions so that we can serve more people. It had always been a passion of mine to come back to a line of work that gave so much to me at that time in my life. Hi, my name is Ginny Hissam. I am a former client of Safe Zone, as well as now the current supervisor of the drop-in. Well, at the time, I was 16 and staying in a shelter. At first, it was mainly basic needs like hot meals, access to hygiene supplies, bus tokens, that kind of thing. Then I became connected to a case manager. Her name was Sky. I feel like Face to Face gave me a lot of the building blocks that I wouldn't have necessarily had based on my life experiences at that time. I was connected to being able to see a counselor once a week. There was an incentivized education program that I was able to get my GED. That definitely opened up a lot of doors to be able to get better jobs and then eventually go on to college.
We are here because there are gaps in our systems, and we are here wanting to partner with our community to do this work. We can't do this work on our own. It's for community, by community.
You should always know that at Face to Face, there's a welcoming environment with the staff that's non-judgmental, that's going to be there to help you.
You know, you're more than just a number trying to receive services from some agency. We want to make it feel personal.
when we put that investment into youth and we can see what they can accomplish and do with it. Just the resilience, but that word doesn't even begin to describe the depth of spirit that so many youth come with. My favorite part about working at Face to Face is getting to do really mission-based work. Being able to examine myself and society. It's looking at things like racism, poverty, community service, how we're all part of a whole and how we need each other. And that is just really rewarding to be a part of.
I serve some very gifted people in some very challenging situations. Right when you feel like you can't do nothing right, another success story will walk in and share what they did.
They have gone through horrible things or been told really horrible things about themselves, and they still find the things about them that they love. And so I think they encourage me to be more brave. Everyone is so different and individual, and they all have their own sense of styles and their own expression of their identities, sexual identities, gender identities. So I think I love seeing people just start to like themselves and not listen to the negative voice in their head.
So they force me to remain young. Yeah, I mean, that's what I like the most, is they force me to remain young.
Just the ability they have to find that strength in themselves to say, I'm not okay. Things are really hard and I need more than I'm getting from life.
Don't ever hesitate. They are a helping hand. If you need help, definitely reach out, because they will help you to expand in your journey.
I think it's a beautiful thing that they're able to ask for help. They're brave.
I would tell the young people, say it with me, I am powerful.
I am powerful, truly.
I am powerful.
I am powerful.
I am powerful.
You are powerful.
You are powerful.
You are powerful.
You are powerful.
Good evening. Thank you all for being here to partner with us as we celebrate our youth and the work that has been done and will continue to do. I'm honored that you are all here to celebrate this success through the last 50 years. It has been my pleasure to lead Face to Face. I follow after many talented and dedicated leaders, some of whom are in the room tonight. Nan Skelton, Ann Rickett, Linda Bennett. Thank you. 50 years ago, the community responded to the needs of our young people. Everyone wanted to do something, wanted to make a difference. And you all came together, raised the funds. You gave your time, your talent to support our young people in the ways that they needed to. And right now, as we look through the 50 years of our history, there are so many people here that we want to thank and be grateful for. If you are a current board member, please rise. If you are a former board member, volunteer, and former staff, please rise. And finally, not finally, but if there are people in this room who are responsible for the funds to distribute to us so that we can do this work, all our funders, please rise. Last but not the least, the amazing current staff of Face to Face who are here continuously laboring every single day. Please rise. Thank you all for being a part of the story of Face to Face. What began as a volunteer-run phone crisis counseling center has grown to a multifaceted response to the growing and changing needs of youth. In 50 years, tens of thousands of young people have accessed medical care, therapy, housing, support, drop-in basic needs, justice programming, education support, employment services, and much more. Each year, thousands of young people have been empowered to overcome barriers and strive toward healthy and self-sufficient lives. To better reflect our learning and growth, we recently updated our mission and vision. Our new mission states, Face to Face works to advance economic and health equity for youth while providing support, access to resources, and opportunities as they build on their strength and achieve their aspirations. Our new vision says that we want all youth to be valued for who they are and realize their potential. We aim to provide youth with barrier-free access to resources and opportunities. To end the pervasive inequities they face, we are focusing on innovative approaches to address the disparities that have been in existence for years. Our work must be creative, long-term, and address multiple areas of young people's lives. Each young person is powerful and their voice matters. Instead of seeing them through the lenses of their needs, we focus on their strengths. It is heartwarming to see their faces light up when they're asked about their strengths. When youth are engaged in finding solutions, they do better and can overcome any obstacle. These pandemic years have been especially difficult for youth due to the increased isolation and stress, the murder of George Floyd, and growing gun violence. The safety nets they counted on were ripped apart. Youth had fewer options and less support. In response, Face to Face quickly addressed their needs. Some examples: we provided services in COVID-safe environments and gave them the supplies needed to stay healthy. We gave access to care through telehealth. We partnered with Ramsey County and the Department of Human Services to provide short-term housing and hotel rooms. We implemented an education and employment training program. And finally, we partnered with the Ramsey County Attorney's Office to serve youth involved in the justice system. It is so important that we continue to be responsive to the ever-changing needs of youth. Recently, we conducted an analysis of our social return on investment. We learned that for every dollar spent to deliver services, the return is at least $3.38 in social value. When we invest in supporting youth, we improve health literacy, food security, physical and mental health, housing stability, and much more. By investing in youth now, we are helping prevent abuse, sexual exploitation, substance abuse, the long-term consequences of untreated medical and mental health issues, chronic homelessness, and even death. Youth are overcoming trauma, engaging in their education, becoming employed, gaining housing, and having healthy relationships. I am proud of the work Face to Face has done, but there is much more to do. In the next year, we have many goals. We will explore ways to advance our new mission to meet the increased housing and mental health needs. We will strengthen the work of our Youth Leadership Council, who will examine youth homelessness and offer recommendations to lawmakers for system change. We will implement a new education and job training program. We will expand our justice programming to youth 18 and over. We will expand the space and services of a drop-in center, Safe Zone for youth experiencing homelessness. We will increase the salaries and benefits of our dedicated staff. We will engage the community, expanding the ways they can support youth by developing a circle of friends for face-to-face. As you can see, there's much to be done. For the next 50 years, we will need to engage more community members in this work. I know you care about youth, but sometimes it's hard to know what to do. We have many ways to help you take action, whether volunteering, advocating for change, or donating. We invite you to talk to us about engaging and supporting youth. Together, we can create a world where all youth are valued for who they are and realize their full potential. And finally, this is where the written script goes away. And I just want to speak to you from your heart, from my heart. Please think of your personal lives. Do you have one young person in each of your lives that you are making sure that they have everything they need to access resources and get opportunities so they can realize their potential? If so, please continue doing that. But if the answer is no, I challenge you, for each of you, to identify one young person you could just love and care about and understand them. Give them what they need so that they can, it's not necessarily much that's needed. It is about giving them your time, your energy, and the opportunities that they would not find otherwise. The most important gift that we can give any young person is our time. Thank you very much.
And as you can see, Hannah's passion is incredible. Absolutely love her passion for this project and this organization. We've reached the point of the evening for our keynote speaker. Peggy Flanagan is a mom, an advocate, a member of the White Earth Band of Ojibwe, and Minnesota's 50th Lieutenant Governor. Her career is built upon standing up for children, working families, communities of color and indigenous communities, and Minnesotans who have historically been underserved and underrepresented. As a former state representative, school board member, nonprofit leader, and community advocate, she now brings her experiences of building coalitions and advocating for children and families to the Lieutenant Governor's office as she works in partnership with Governor Walz to build One Minnesota. Everyone, please welcome Lieutenant Governor Peggy Flanagan.
Well, good evening. How are you? Good. Hannah, you're wonderful. And as a recovering executive director, let me tell you that return on investment is a good talking point. So I hope all of you heard that. So Bonjour, my name is Peggy Flanagan. I am honored and humbled to be your Lieutenant Governor, but mostly I am here because I am a cheerleader for this organization. Face to Face is incredible, and I'm so excited that I get to celebrate your 50th birthday. You don't look a day over 25, so congratulations on that. And to the team at Face to Face, both present and past, thank you. Thank you for everything. Since 1972, Face to Face has served young people experiencing homelessness or young people who have been at risk of experiencing homelessness on the east side of St. Paul. There was a gap in support services available to youth in this community, and Face to Face stepped up and just kept stepping up. And the work has been incredible ever since. Former executive directors have advised former governors on the Minnesota Task Force on Youth Service and work in providing firsthand experience to the field to report on ways in which the state can better build and develop resources for youth. Medical directors and directors of finance alike have also used their personal and professional relationships among nonprofit organizations and large health centers to address the basic needs of homelessness and the basic needs of homeless youth through boards and different advisory councils. And together with program managers and staff and hundreds of people who have offered a hand to Face in the last 50 years, this organization has provided transformative programming to improve the lives of young people. Collaborations like these led Face to become the first drop-in center for homeless youth in St. Paul in 1994. Safe Zone, as it is known, continues to run today and is the only drop-in center for homeless youth in St. Paul. What Face now offers is culturally competent and trauma-informed comprehensive health care, which is incredibly rare in a world full of big healthcare and very limited funding. Seeing the whole person, the whole young person, is what is making a difference. And this approach is incredibly important because it meets the needs of young people, but also because it works. We know that culturally responsive, culturally specific, culturally celebrating care works, and we need more of it. And as I mentioned, as a recovering executive director and as a former organizer, I have deep admiration for the work of this organization, and I am so grateful. And I think what makes this organization so special is that the work of Face is youth-centered. It's not just, that we have young people stop by for a cheesecake snapshot or invite them to the table after all of the decisions have been made. They are the heart of this organization and the heart of this work. That means that there is a seat at the table for young people to tell us exactly what they need to be successful. And, I know that young people will tell you the truth. I have a 9-year-old who keeps me very humble every single day. And they have been successful because youth who walk through their doors trust them. They trust them. And Face understands that the best solutions come from folks most directly impacted. There also is an important understanding of holistic solutions. Our young people do not come in pieces. Our families do not come in pieces. Our communities do not come in pieces, and Face understands that. Housing is connected to education and food security, economic opportunity, and so much more. And a safe place to call home or to go at night is the foundation for all of it. That's why the governor and I prioritize investments in housing and our response to homelessness statewide since we took office, so that organizations like Face can do their work in a good way, in the way that they know how. So in our budget proposal this year, we proposed nearly $1 billion to invest in statewide response to housing and homelessness. And that includes priorities like this: expanding the Homeless Youth Act by $11 million to enhance the supports provided to youth and young adults in need of assistance, and increasing the number of housing units for youth experiencing homelessness, focusing on young parents and LGBTQ youth who told us what they needed. Increasing shelter capacity and services for Minnesotans, including youth experiencing homelessness, investing in supportive housing models, increasing support for mental health for our young people, expanding healthcare coverage for foster care youth, and more. And we have to get it done. I mentioned these items today because they are in our budget, because of organizations like Face, because of the work that you do every single day. And I hope, Hannah, and everybody in this room, you can see your fingerprints all over our budget. And I'm a policy nerd. Are any more other policy nerds in here? I'm a policy nerd, so I could talk about budgets and state government all night, but I know you're not interested in that. But it is part of the puzzle. It is part of the puzzle, making sure that we are implementing the policies that we need, that our young people have told us that, frankly, we have not just an opportunity, but an obligation to our young people, in particular when we have a $10 billion surplus. Do not tell me the resources are not there. So every year, Face to Face serves about 3,000 youth and reach an additional 5,000 more youth through health education and outreach. And those numbers didn't change last year. That's a lot of people in a smaller space. That's a lot of people given the uncertainty of COVID-19. It is impressive. It is powerful. It is the right thing to do. And the last 2 years have been extremely hard. We all have experienced losses, both big and small, that have been deeply personal. But what Face to Face does and what Face to Face did, they did not stop. So to the team at Face to Face, I don't know how you did it. But if I were to guess, I would say it's because of the young people who walk through your doors. The very people, their faces, the personalities, the stories, the strengths that they bring with them when they walk through that door. And you fight for them. And I would like to invite Hannah back to the stage here with me as I proclaim April 28th Face to Face Day in the state of Minnesota. So I am representing my coworker, Governor Walz, as well. He's my favorite coworker. And I want to read this proclamation that we've put together for you and for Face to Face. Whereas for 50 years, Face-to-Face health and counseling has provided essential support for marginalized young people in Minnesota, empowering them to overcome barriers, strive towards healthy and self-sufficient lives, and contribute fully to our community. And whereas Face-to-Face opened in 1972 as an all-volunteer walk-in crisis and counseling and reproductive health care clinic that today provides mental health services, medical services, housing assistance, case management, basic needs assistance, and much more. And whereas in 1994, at the request of the state of Minnesota and Ramsey County, Face-to-Face opened the Safe Zone, a drop-in center for youth experiencing homelessness that offers safety from the streets, guidance from trusted adults, hot meals, counseling, access to shelter and housing, and other essential needs. And whereas for 50 years, Face-to-Face has helped tens of thousands of young people make informed decisions about their lives and thrive as members of the community. In spite of the barriers they face, the young people at Face-to-Face have secured stable housing, improved their mental and physical health, advanced their education, set and pursued career goals, and participate fully in our community. And whereas on April 28, 2022, Face-to-Face Health and Counseling will honor all of the young people it has supported and celebrate their achievements at their 50th anniversary event. And whereas today we honor and celebrate Face-to-Face Counseling, as well as all of the individuals and organizations that have supported it for 50 years. Thanks to the Minnesotans who have helped young people heal from trauma, build stability, and contribute significantly to our state. Now, therefore, I, Tim Walz, Governor of Minnesota, do hereby proclaim Thursday, April 28, 2022, as Face-to-Face Health and Counseling Day in the great state of Minnesota.
Well, so far tonight, you have seen videos of those impacted by face-to-face. Now you are going to hear from someone directly. Michelle Gellerman has been in CFO positions for healthcare organizations in the Twin Cities for the past 30 years. She is a former face-to-face staff member, and her daughter has been a client. She's also a supporter and donor. Michelle?
Good evening. Thank you, everybody, for coming this evening. I feel like I'm going to not come anywhere near Lieutenant Flanagan. I am here tonight to tell you about why I choose face-to-face as part of my giving program. Face-to-face does hold a dear spot in my heart. It's a community organization that helped my family when we were in need. I'm going to take you back to 2003. I lived about 4 miles from face-to-face. My daughter was 16 years old. She was on the gymnastics team at her school. She had a job, and she saved up money from her job to buy her own first car. She was a good student. She had good friends. She was a great kid. She had a dream to be a hairstylist. For a CFO, that's not really what I wanted, but you know, that's what she wanted. And then one day a light switch went off in my daughter. Within a few days, her school called, and they were also quite concerned. They had noticed a big change. She was no longer outgoing. She wasn't doing well. We determined that she had been assaulted, and that assault caused her to go down a really dark path. She did use support systems through the community and at school. She had the support of a family, but it just wasn't enough. She started cutting herself to try to mask the pain. She started smoking pot to try to mask the pain. She did graduate from high school. Oddly, graduating from high school took her down a darker path. She started using crystal meth. I lost my daughter for several months. She lost her job. She changed all of her friends. She lived on the streets. She ripped off a drug dealer, and he put a price on her head. I had been going to Al-Anon, and I had learned from Al-Anon how to help her. I did reach out during the drug dealer crisis, and she came home. I gave her an ultimatum. She could either go to a treatment center or she could go live with my brother in Florida. Fortunately, she chose a treatment center. She went to the treatment center, she got clean, and she found her higher power. She keeps that with her to this day. When she came home, she started going to face-to-face for therapy. Her therapist there worked with her and provided her tools that she also continues to use to this day. She has a little box that has little physical slips of paper in it that she continues to use. Her body and soul healed. She did the payback. She did realize the payback. Since those days, some of the people that she hung out with during that time most of the people have been lost to drugs. Most of them are no longer with us. And that could have been her outcome. But instead, she did become a hairstylist. She actually owns her own hair studio and yoga studio. She's married. She has 3 wonderful kids. She's a homeowner. She's on a really good journey now. Her life is good. Face to Face helped give me my daughter back. I am a CFO, and so I can read financial statements. It's an organization that I continue to give to because I know I make an impact. I have worked for other healthcare organizations, and their Face to Face is the only one that I give to. So I just hope that you will consider giving Face to Face, making them part of your giving plan. Thank you.
Now I'd like to bring to the stage Dr. Sophia Ali. She is a board member and medical director of Neighborhood Health Source.
Thank you, Matt. Most of you know that Matt is a meteorologist. I'm wondering what your forecast is for giving this evening.
I predict a 100% chance of showers of support with localized downpours of generosity.
There's a forecast we can all stand behind. Matt introduced me. I'm a family physician. I'm also serving as a member of the board of directors. When Hannah invited me to serve on the board, I already knew a lot about the organization because early in my career, I worked there delivering prenatal and healthcare services. It's great to be part of an organization that reaches back 50 years and forward into an exciting future. This has been possible through the ongoing financial support of many people, including people who have given regularly over decades, some of whom are here in this room tonight. I support Face to Face because I have 3 adolescents, and I believe, like most of you in this room, that for a community, all children are all of our children. So it's not just about my children, all of our children have to do well, and together we can help them thrive. Every youth who is served by Face to Face has a name and a story. Some of these stories absolutely break my heart. And you haven't even heard some of the hardest ones. But what I love is that everyone involved in the organization sees that those heartbreaking stories are only part of the tale and do not define the youth. The youth are writing their own narratives. They feature hopes and dreams, determination and grit. Please join me in partnering with Face to Face to build a community of care, support, and belonging that has changed and will continue to change lives. Now, there are many of you who know me in this room, and you know I'm not Minnesotan, so I'll just be direct and get right to the point. It is time for you to pull out your phones, your pens, your credit cards, or old-fashioned cash, and please give to ensure that Face to Face can continue to support youth through the current services and to meet many of the unmet needs in our community. There are many young people who could benefit from services that are not receiving services now. Now more than ever, young people need Face-to-Face's wraparound services. And they have made it really easy to give. You can fill out the envelope in your program. You can scan the QR code in your program. You can go to the website. You can give cash or a check in the envelope or a credit card at the t-shirt table at the back. Board members and staff are going through the aisles with envelopes if you have donation envelopes to put in. And I will get out of the way for a moment while we listen to another voice of one of our youth.
A Broken Home by Cooper. The day my father left is the day my heart became cold, and I gave my soul to the devil. It's a story that is untold, and truth be told, my work became one whole. This world is like poker, it taught me it's okay to fold, to hide the pain and not let it show. Now I know it's not my time to go. Growing up, all I saw was blood, pain, and snow. Now I'm trying to figure out which way to go. Should I be bold and tell everybody I was sold, which caused a broken home? I don't know. Maybe that's another story to remain untold. For this is a story of the pain I went through and overcame because I was broken. And I stood to put myself back together. For all you who is going through the same thing, I am here with you. Remember, you are just as strong as I am.
That inspiring poem illustrates why Face to Face exists and why we are here tonight to fund the sacred work of helping every young person on their path to feeling whole again. To encourage you to be as generous as possible, 2 wonderful supporters have provided matching funds tonight, so your gift will be doubled. And tonight is just the beginning of celebrating Face to Face's 50 years. Stay tuned for exciting information about the upcoming 50 for 50 pledge opportunity and the founding of the Face to Face Circle of Friends that Hannah mentioned earlier. Thank you, everybody.
Well, everyone, even though this is the end of our prepared presentation, remember, the giving continues. There are people, there are board members out amongst you willing to take donations, take those donation envelopes. You can go to the t-shirt table at the back, use your credit cards. Remember, you can always go to facetoface.org, and it doesn't even have to be monetary. Remember, time and talent donations can make just as big of an impact on all of the youth you saw here tonight and everyone who can come in the future. So thank you for supporting the first 50 years of Face to Face. Here's to 50, at least 50 more. Thank you.